that understanding both Social Security and Medicare in their entirety is not possible in 40 minutes, okay? So we're just going to work on the basics today. But the slides, we actually have put a lot more detail into slides that we're not going to show today, but if on the QR code, if you'll pull that down, you'll have more information on a number of pieces here that will be helpful to you, hopefully. Anyway, it's good to be with you guys today. Let's get started, and I think we have to start here, right? What's the 900-pound elephant that's in the room? Who knows? Somebody speak up.
Is Social Security going to be there?
Is Social Security going to be there, right? You've all heard the situation, what we're involved with. I think this illustrates it. This is 1960 of what the population looked like. We had this many people on Medicare and this many people contributing. Look at it today. At where we are. We've got people are living longer, we've got fewer children, there are fewer workers. This is an unsustainable model. So they're going to have to come up with some things, but they do have some things that they can do. This report, by the way, was published just in May, so this is recent. We're saying now that retirement benefits basically, that they're going to be more going out than coming in. That's already occurred. But here in 2033, there will be no more trust fund. And if you've heard of the trust fund, basically it's a big container of IOUs. The government already spent that money, and so they're producing bonds and borrowing to try to pay this. All right, but they're saying if nothing else, there would be at least 79% available to pay Social Security benefits in 2033 if nothing changes. And I'm fully convinced something's going to change. We get proposals continually. Medicare is a similar situation, but a little better situation. Here you've had some, we think that expenses might exceed receipts, but we do have something in the trust fund there. We think maybe by 2036, if nothing is done, it would drop back to about 89%. These are the most recent numbers. And you might even hear 2035 here. It's 2035 if you combine the retirement pool with the disability pool. This is retirement pool only right here. All right? So we do have some issues to face, but there are a number of things they can do. Obviously, they can increase the payroll tax. We pay 7.65 employer, 7.65 employee now. That could go up. They could increase the retirement age. They've already done that. It started at 65. It's now 67. They've worked that through, with some changes. We could see that go even to 70 or 72 perhaps. We could see a cut in benefits, that they just, pay out less, or they ask people to pay more to be in some of these things. Allocating government revenues. The government could actually just fund this themselves if they wanted to, and that may, and they're doing that partially right now, and it may be that they continue to do that. They are means testing right now. If you have a high enough income, you actually pay more for Medicare than somebody else normally does. In fact, you can pay $500 a month normally if you've got the means. So they can continue to add means testing to this and charge more. And they can just, they've already done this, but they've already taken what was CPI and taken it to CPIW, which is a small shift where they've said, we're not going to give you the full CPI every year. So there are different things that they've already started to do, but there have been a lot of proposals. And you're going to see some combination of this probably in the next 10 years. So just be prepared for that. But I don't think it's going away, and I think it's something that we need to get our arms around still. So let's talk about the retirement income side of this first. This may be the largest part of your retirement income. It's guaranteed for you and your spouse. It increases annually with inflation. It doesn't matter about market volatility. You just keep getting paid on this. You can't mess it up if you invest poorly, So it can also make up for a lack of retirement savings. If you've not saved enough by delaying your Social Security benefits, you can have more in retirement, more income in retirement that makes sense for a lot of us who typically want to work longer anyway. So a lot of us start late because of seminary and other things, and so we have an opportunity to maximize it. Now, who's eligible for it? Well, workers, their spouses, and survivors. A worker has permanent benefits if they have 40 quarter credits. That's about 10 years worth of work. And it could be in pieces, 2 years here, 3 years there, and so forth. It doesn't have to be consecutively. In fact, if you earn $69.20 in a year, roughly $7,000, you're going to get all 4 credits for that year. So even a part-time worker is going to work their way into this if they're at all working for 10 years. Spouses are eligible too, even if they've never worked a day in their life. They're eligible for 50% of their worker spouse's benefits once they get to a certain age, and I'll explain that in a minute. But the survivors, if God calls one of the 2 home, the survivor keeps the larger check. So if you get 2 checks in a family, one bigger than the other, the survivor gets to keep that large check, that smaller check goes away. All right, so how much you're going to receive? Well, it depends. Depends on how much you earned over the years, how much you paid in taxes and so forth. So your benefits are going to be higher if you paid in a lot more in taxes. It also has to do with how long you work. They take a highest 35-year average. What if you've only got 20 years that you pay in? You get 15 years of zeros, right? So that's the kind of thing that can hurt you, and working longer can really help you because you're bringing that highest 35-year average up. And you think of where your average is now compared to where it was maybe 20 or 30 years ago, and you realize that even if you've got 35, by working another 2 or 3, you put higher earning years and you knock off the lower earning years. And that highest 35-year average has a lot to do with what you're going to receive. And of course, something you can control when you actually apply for benefits. If you apply early, you get less. You delay, you're going to get more. All right? So that's how we determine that. So there are a lot of things that depends on there as to what you're going to receive. When should you claim then, if that's something that you can really control? Well, notice if you claim early, and these numbers are changing, by the way. How many of you have birthdays after 1960 or after? All right, for you guys, this is 70%, not 75. And this is 124, not 132. So for the older guys, this is the layout, but it's shifting every year for the next 4 or 5 years. But what we're saying is, if you wait to full retirement age, you get whatever the full amount is. You start early, you're going to get less. You delay, you're going to get more. Notice the difference between, let's say, 70 and 124 or 75 and 132. You're going to get a lot more if you delay. All right, we'll talk more about this in just a second, but here's some tips here. If you're married, what you want to do is you want to plan for longevity, and you want to plan for the youngest spouse's longevity. If you've married someone that's 10 years younger than you are, you've got to plan for them to live 10 years longer than you will. You just got to plan for that and accept that that's going to be part of the cost here. You want to plan for your spouse to live into their mid-90s. I've talked to a lot of people that say, I think this is how long I'm going to live. I'm going to live to this age or that age. But we don't know how long we're going to live, do we? We don't really know, so you want to plan assuming that you're going to get into the mid-90s. I often tell people you want to plan this way because going back to work at 90 is difficult to do. All right. So you want to maximize the largest Social Security check. Again, you get 2. The small one goes away. This is a couple, right? There are 2 checks. The smallest goes away. It leaves the larger check. It's a 2 lifetime check. If you're going to delay one of these to get the maximum benefits, delay the large one. It's also the survivor benefit. It really helps your spouse. So if we're planning for spouses to live long, we're going to delay that check, okay? Claim the smaller check based on health and income needs. Once you get to full retirement age, and that spouse is eligible with the smaller check, is eligible for 50% or so of whatever your check is, we've sort of maxed that out. And for a lot of spouses, they will go in at full retirement and claim if they have the smaller check. Not a bad thing, but what if you're $300 under what you'd like to have for retirement every month, and by waiting and delaying that check, you'd get $300 more. And you're working anyway, and you don't need the income right now, at least not yet. You may want to delay both checks. So we'll talk more about that. And these are things, by the way, that really require you to sit down with somebody like what we're doing at Geneva and ask questions and say, okay, here's where we are. Here's what the Social Security Administration says. What should we do in our situation? And we would love to sit down and talk with you and give you some counsel on that. So, all right, so there's a little bit of some pro tips there on the Social Security side. We've got to keep moving. I know I did not satisfy all your questions with Social Security, but please, not only can you get these notes and things with the QR codes, but please get in touch with us. We are here to serve you. We'll set up time to meet with you. We can do it over Zoom or a phone call. Some people tell me I don't have a face for Zoom. They'd rather talk on the phone. So if you feel that way, we can do that as well. But here's Medicare 101. Let's jump in, okay? Medicare is a government-sponsored health insurance program. It's divided into 4 parts. Here they are. Part A, hospitalization. Part B, outpatient services, doctors, those kinds of things. Part C, you've got an Advantage plan, or you can go with a supplement plan. You've really got a fork in the road there. We'll talk about those in just a few minutes. And you got Part D, which is a prescription drug plan. Now, if you don't have 4 parts, you've got some issues, all right? Let's look at Part A first, though, so that you understand it. This is hospitalization. It's nursing care, skilled nursing. It's home health care, hospice, psychiatric care. This, if you have 40 quarter credits with Social Security, this is free. If you don't have Social Security, you don't have 40 quarter credits, maybe you opted out of Social Security, we especially want to talk with you about what you can do to get in, because you could have to pay $500 a month for this part that nobody else is having to pay for. You could easily get into the system, most likely with a little bit of work, and we can explain how that can happen. Or maybe it's a spouse who could work just a little and get you in. But look at this, $500 a month is basically $12,000 a year for a couple over, let's say, 20 years of retirement. $250,000. Keep in mind, I'm just taking this year's number. That goes up every year. You're talking $250,000 to $300,000 just to buy Medicare Part A over a 20, 25-year retirement period, and you don't need to spend that if you can get in the system. Now, you can't undo necessarily what you did if you opted out of Social Security, but there are ways to get you these 40 quarter credits and get this for you. And so you want to talk to us about this. We're here to help you figure this out. But this is critical. You start here. You start with Medicare Part A. All right, Medicare Part B. What is it? Well, it's all the doctors that you go to. It's all those outpatient services that are out there. It's physical therapy and skilled nursing, durable medical equipment of different kinds. Maybe you need a bed at the house or something, oxygen or whatever. You've got all these things. This is not a free piece of Social Security. You pay for this every month. Every senior does. This number goes up every year, but it's $174.70 right now a year. There's a $240 deductible with that. And there's co-insurance, usually about 20%. And you think, co-insurance, wait a minute, that could cost me a lot. They're only going to pay 80 of my bills. I got to pay 20 after we get to $240. I'm going to get hit with co-insurance? Yes. And we're going to talk about that in a minute too. All right, so this is what they call original Medicare. Part A and Part B together, this has been and was for years original Medicare. You can see any doctor that accepts Medicare out there. You're not in a narrow network. You can go to MD Anderson or Mayo Clinic. You can go wherever you want, and you can use your Medicare to get you there. It's for both inpatient hospital and all these doctor visits and outpatient surgeries and things that you might have, but there's no drug coverage with this. All right? So here's the problem. With Part A and Part B, there are all kinds of holes and gaps. And so you could literally end up paying thousands and thousands of dollars out of pocket here. In fact, there's no limit. Can you imagine having something serious and being in the hospital and running up $1 million or $2 million? We've had people do this in plans even 20 years ago. It's not hard to run up $1 million if you have some issues, all right? But there are no upper limits to this. You do not want to be paying co-insurance during this. And there's no drug coverage either that's happening. So you need these other pieces. So let's talk about these other pieces for a minute that can solve these problems. You've really got 2 options. You can go with this supplement plan, sometimes called a Medigap plan. You probably heard of that. And then I know if you've watched TV at all, you've heard of Medicare Advantage plans, and sometimes called Part C Advantage plans. You've got these 2 options. Let's talk about them. All right, let's start with the supplement plans. The supplement plan adds on. You've got your original Medicare, but you're adding this. You're just buying it. It's a private health care policy with Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, whoever, Humana. And basically, it's covering all those holes and gaps. It's helping with deductibles. It's doing a lot of things. There's no drug coverage, so we're going to have to work on getting some drug coverage still. But it is making this palatable. All those no upper limits and co-insurance things go away. It pays all of that. All right, so we want to look at what that plan could do just briefly here. Again, private health insurance, it piggybacks on Medicare, fills holes and gaps, covers a portion, if not all, of deductibles, copays, and co-insurance. It's guaranteed issue. Who knows what guaranteed issue means? It means
when you enroll, you're guaranteed to get it no matter what preconditions you have.
There you go. How many people thought pre-existing conditions went away with Obamacare? Not for Medicare. For the policies you have now, but not with Medicare. And so this is huge. You do not want to lose this opportunity. You can have stage 4 cancer and be in the most expensive treatments out there and walk in and get covered. So you want to take advantage of guaranteed issue. You've got 6 months from the time that you sign up for Part B to get that done. You get outside of 6 months, and we've seen this happen. You get outside of 6 months, and it's no longer available to you. They can deny your coverage, or they could, simply not take on any of the pre-existing issues, give you coverage for some things and not others. Very important. So understand what you got here. They're standardized plans. There used to be 10. They've gone to 12. They're kind of back down to 10 again. They've got a number of standardized plans. What that means is the government's already dictated that if you have a G plan or an N plan or whatever it might be, these are the things it's going to cover. Let me see if I can show you here. And here is a plan A, a plan B, a plan G. Now, whether you buy, let's look at G for a minute. Whether you buy G from United Healthcare or Blue Cross or Cigna or Humana or Aetna or any company that's selling it, it's going to cover exactly the same things. The difference is going to be price and service, but it's going to cover the same things. You have a number of plans here. G is by far the best, covers everything except one thing. What is that? The $240 annual deductible. Can you cover $240? They used to have an F that covered everything. And it was $600 a year more than the one where you had to pay the $240 deductible. And everybody got in the F plan. and so they decided to get rid of the F plan. They like you having some skin in the game, so they want you to pay the $240. If you'll do that, though, they'll cover everything else. It's a great plan. I'm in the G plan, just so you know. I've made this move to this plan. But this is in the slides, so you can kind of look at the different things that are being covered. Yep. Let's talk again about the other plans, the Advantage plans. Now, some of you have probably seen this commercial on TV. Do you ever wonder how, there you go. Do you ever wonder how you can have an Advantage plan that costs almost nothing, provides you with dental and vision and trips to the doctor, could possibly even pay your Part B premiums every month if you have low enough income? How can this be possible? Well, y'all been around long enough to know there's no such thing as a free lunch. And I'm going to explain how you're going to pay for this. All right? Though I like Joe. Okay, Part C. It fills the holes and gaps, but it is an alternative. This is not original Medicare. Original Medicare is A and B. You can add a supplement that fills holes and gaps. This wraps all of it in a big wrapper, like an HMO type thing. And basically, Medicare will not pay your bills anymore. It's going to be paid by a private health insurance company that you're with in this. And the private health insurance company is going to determine what they're willing to pay for your care, because the federal government's going to give them a flat fee for everybody in that plan that year. And it's usually a narrow, small network in a local area. And so they'll say, okay, we'll give you X thousand of dollars. You've got this many people. We'll write one check. Here it is. You decide what to do. Well, what happens in a bad year? What happens if the hospital's in the red? Are you going to get that extra, diagnosis? You're going to get a second opinion? Are they're going to run this test or that test? No. To be honest with you, I don't know if any of you know Clark Howell. He's on the radio in Atlanta, and he's constantly saying, don't do this. I beg you not to do this. Because you get into this, and you're not going to get care. You're going to be denied a fair amount of care. You're going to have a narrow network. You can't go out. You can't go to Mayo. You can't go to MD Anderson. You're done. You're just in that network. Whoever will see you, and you're going to have it basically managed medicine. Again, not government managed care, but by that company, and they're going to try to save money. The government loves this. It saves the government a lot of money. And if you get enough people, and they're well enough, which is why they also give you, an ability to go to work out and do all those different things, gym memberships and that kind of stuff. If they can keep you healthy enough, then they can make money. If they're not making money, they just kind of deny care. So this often includes a drug plan, so it can save you the premiums on the Part D, which we'll talk about in a second. So there are all these things. Look at this: vision, dental, hearing, fitness, wellness, telehealth, all kinds of stuff. How's it possible? You won't get the same level of care here. So just be prepared for that. If you don't have the money, do this. Okay? Don't let it go by. Don't just do A and B. Do this if you don't have the money for a supplement. But if you can afford it, you need to get a supplement plan, not go with this. This is very difficult to switch as well. Once you get in, it's very hard to get out of or go to another plan. And so there are people, honestly, who are locked into this who can't get out. And according to Clark Howell, there are people who are dying because they cannot be seen by the doctors who could probably help them. So anyway, just be aware that this is not what it seems. All right? Okay. Cost of this varies. There are co-pays. If people are going in doing co-pays with their Medicare, it's probably because they're on this type of plan. There are flat co-pays. There's co-insurance. You can be surprised if you get sick on one of these plans, it could actually cost you more than that supplement plan. So beware of these plans. There are a lot of them out there. You're going to get tons of notifications in the mail about these. That they really want to get you signed up. What happens after 6 months after Part B? Who remembers what happens 6 months after Part B and you don't sign up for a supplement? What will happen? Pre-existing conditions come into play. You lose guaranteed issue, right? You go to this for 6 months, you've lost guaranteed issue. You're not switching out. So be very careful about this. Again, try to warn you. All right, let's talk about Part D, because if you go with A and B and you get a supplement to fill the gaps, you're going to need a separate drug plan. You're going to have to get something. It's about like this. How many of you heard of the donut hole? Did you know the donut hole's closing next year? It's going to be completely closed. The donut hole was where you had coverage for a while, but then you lost your coverage, and then you got some back. And it's been changing ever since basically the ACA, Affordable Care Act, Obamacare. Ever since then, it's been closing, and in the last bill that they passed, they sped it up. 2025, no more donut hole. You're going to have coverage all the way through here, and your out-of-pocket's going to be somewhere around $2,500 a year max. So it should be a pretty good situation from the standpoint of these plans, and maybe not quite as difficult as it used to be to understand. It adds on. It's just you're adding this here for prescription drugs. Each of them has a formulary of things that they will allow you to purchase in that plan. And when you buy these plans, what you've got to do is you've got to understand a little bit about what's in the plan. The costs are based on tiers. You've got low-cost generics. You've got preferred generics, and it works its way up to the brand name drugs and so forth. But there's this place you need to know about, and I've made a copy of it here. Go to Medicare.gov on the website. You can enter in the drugs that you're currently taking. Just put them in. And then you can give them your zip code and all the things they need to know. You hit enter, and it'll show every drug plan in your area and what the cost is in your area, not just for the premiums of those plans, but the premiums plus the cost of your drugs. And that's how you decide this. That year you say, okay, I'm taking these 3 medications, and the cost of these 3 medications on this plan, for example, a $20 plan, this might be $400. But a $50 plan, this might be only $100. It's crazy like that. So you've got to shop these and combine the premium with the cost of your drugs on that plan. You'll figure out through that what's the best deal. And you just literally have to do this every year. You really do. Every year in the fall, there's open enrollment. Open enrollment gives you an opportunity to go back in. Maybe you got prescribed a different medication, put them back in, see what your best deal is. You might want to pay more premium and pay a little less for the copays on the drugs. All right? So you want a very important website. Pick a plan based on current prescriptions, not future, not anticipated, current prescriptions plus the premium, whichever's the cheapest, go with it. Because I have only 2 generics that I take right now, I've got a very cheap drug plan of 50 cents a month. I know it's going to kick me hard the next time I get some kind of medication that's going to be very expensive. But when it does, that fall, I'm going to move over and get a plan and figure out what the best way to pay for that prescription is. Right now, I'm saving money. So this is how we handle drug plans. All right. This is really important. This may be one of the most important things about the seminar here. Some of the biggest mistakes people make in Medicare is not knowing when to enroll and enrolling at the wrong times. Do you know there are late penalties for Part A, Part B, Part D, and the supplements because you lose the guaranteed issue? There are a lot of penalties out there, and they're just going to add it to your bill, and you don't want to be surprised by this. Let me show you the 4 enrollment periods you need to understand. The first one is the initial enrollment period. Initial enrollment periods are when you turn 65, right? It's when you turn 65. You got 3 months before your birthday, the month of your birthday, and 3 months after your birthday. It's a 7-month window. You sign up in the 3 months before your birthday, it starts at the very beginning of your birthday month. You sign up during your birthday month, it starts the next month. After that, if you sign up in those last 3 months, it may be a month or 2 before it starts. And there's a slide, you'll see it in the addendum down here that explains and shows you that. So when you sign up is important. You don't want to be without coverage. And so you want to take a look at this. Almost everyone in this room is probably going to need to sign up in the initial enrollment period at 65, and I'll explain that in just a few minutes. Some of you may be thinking, well, I'd like to delay. Some of you can, but most of you won't be able to do it. Now, if you have employer group health care coverage right now, how many of you do? How many of you are in a church where you've got employer? All right, so you've got an employer coverage where you are. And how many of you are in a group with more than 20 people on that plan? Okay, I see about 5. All right, you will be able, if you want to stay on that coverage if you choose to do so and basically sign up later. If you do that, that's the special enrollment period. And that can take place whenever you decide to leave that plan or whenever you retire. It's up to you. You can just decide to leave one day, you sign up, and on the first of the next month you have coverage. There's also a general enrollment period. If you didn't have this, or you forgot about it, or you were supposed to have done this and you forgot about it, you can always come down here. Now, general enrollment period is January through March, basically 3 months. And if you sign up from January to March, you can be covered beginning July 1st. So what if it's April the 3rd and you've realized you should have signed up for coverage and you missed it? Guess what? You're going to wait from April all the way around to the next year to January, February, or March to sign up and have coverage beginning the next July. Over a year, you will not have coverage. Enrollment periods are very important. You need to understand them because this is going to hurt you if you don't do this one right. Coverage begins July 1st. Big gap, a lot of waiting. The last one, open enrollment. I mentioned this one a minute ago in Part D. Remember we were talking about drug plans and saying you could kind of shop around and switch them and get a better plan? Well, that's what this is for. This is only for people who are already enrolled in Medicare, and it gives you the opportunity to switch if you can. If you can switch from a C plan to another C, do it now. If you want to switch your drug plan, you do it during this period of time. You only got about a month and a half or so there, but you can do it during that period of time. And you want to stay, if you do the supplement plan, you just want to stay with that. You don't want to be switching those around. All right, top 10 mistakes. Here we go. Waiting to sign up until your Social Security full retirement age. There's a difference between 67 or 66 in a few months for those of us who haven't signed up yet and are a little older. There's a difference between the Social Security retirement age and Medicare age. When does Medicare start? At age 65. There you go. So you want to make sure you don't make that mistake. Number two, your weight, assuming you don't qualify or haven't worked enough. Some of you may feel that way. Maybe spouses might feel that way, haven't been out of the market, raising a family. Maybe you opted out of Social Security. I'm out of Social Security. Why should I sign up? Oh, it'll bite you. Let me tell you, you can pay permanent additional penalties in this program if you don't sign up. Even if you've opted out, get in, pay the $500 a month, get in this program, and get started at the right time so you don't pay penalties. And you can work your way in later, or you can just stay and pay your way. But you want to be careful to get in. And again, we're here to help each of you. Each of your situations is a little different, so just know that you can call us and set up a time to meet and talk about this stuff. Failing to enroll on time, delays in coverage. Remember I showed you the April thing could go all the way on to the following July. Late penalties, that was one of the biggest mistakes here you can see that people are making. Believing that you don't need Part B. If you have retiree or COBRA coverage or some other type of thing, you will. How many of you have any kind of government like VA, CHAMPS, TRICARE, any of those things? You need A and B. You got to have both pieces underneath that, all right? What about not signing up for D because you're currently not taking any prescriptions? That's a big mistake too. That one will bite you. For every month you should have been enrolled, they're going to add on to your premium. You may be paying double or triple the premiums by the time you actually do get in. They don't want you waiting until your house is on fire to buy insurance, right? Insurance works when everybody pays in when they should. And so they want you in there, even if you don't take anything. Like I said, I've got a plan right now that pays 50, or it costs 50 cents a month. You can afford 50 cents a month. Get in a plan so that you don't get bitten by the penalties when you need it. Number 6, picking a Part D plan for the wrong reasons. I've talked to people who said, well, maybe I should pay for this little more expensive plan because if I do get, prescribed something that's expensive, it'll be cheaper on this plan than the one here. None of us know if you're going to get prescribed that or when or if that'll ever happen. Don't do it. Each year, look at what you're on that year, choose your plan that way, and adjust as you go forward. That's the best way to do this. All right, misunderstandings in enrollment periods. Late buying Medigap, losing guaranteed issue, right? Big issue. Failing to read annual notice of changes. If you are in an Advantage plan, those plans can go away from one year to the next, and they can totally change. And so you're trying to figure out, can I switch at all? And if I can, where can I go to get another plan? You want to read these things. Every fall, it's required that your plan sends you notifications. You do not want to put those in the round file. You want to read those and find out what's going on with your plan and make a decision between October and December if you have to get another plan. Not realizing that you may qualify for lower costs. There are people on very low income side of this that can get help from Medicaid. There are state, this SHIP is for state health care insurance program that helps provide counseling and other things to help you through these things. Very helpful programs here. So there may be, if you're at the low levels of income in retirement, there may be some help for you at your state levels. So just be aware of that as well. Let's go with a few recommendations. Okay, that's going to make your eyes cross, so let me give it to you quickly. Everybody sign up at 65 unless you have employer-provided health care with more than 20 people on the plan. Why is the 20 people thing important? Because here's what happens. Your employer coverage is out here, and maybe you even sign up for Part A Medicare, which you can do and keep your employer coverage, especially if you got 40 quarter credits, it won't cost you anything. So you can sign up and it becomes secondary coverage if the plan has more than 20 people. What if the plan has less? Plans with less than 20 people are written to make Medicare primary and your coverage secondary. So what happens if you don't sign up for Medicare and your coverage just became secondary? You don't have coverage. And whatever Medicare would have paid for, your plan's not paying. It's going to fall on you. So you've got to get in if you've got employer coverage and you're under 20 employees. And if you don't know, talk to the plan administrator, find out how many people are signed up and in the plan. But look, if you're with a sharing ministry, if you've got an Affordable Care Act policy, if you've got an individual policy of any kind, anything that, whether it's Obamacare or not, you've got to get in at 65. Otherwise, you start accruing penalties. You've just got to get in. You've got to sign up. And again, you can put Part A behind your employer coverage if you want to. If you've got TRICARE, federal, state, VA, CHAMP VA, other types of things, Veterans Administration, you've got all that stuff, then you do need to have A and B, but this may help you. You may not need a supplement with that. But down here, you can stay, you can wait. There's an enrollment period. If you're in an employer coverage with more than 20, you can do it if you want to. To be honest with you, I'm not sure if you want to. I think you'll come out better, actually, here. You'll probably get more covered with this policy than your current health care policy at work. And you can see every doctor. It's not limiting. The only time you're going to get limited is if you go with an Advantage plan, one of those Part C plans. All right. How are we doing here? I'm breathless. How are y'all? There's a lot more, y'all. We've got probably 40 slides at least below this of all kinds of detail, Part A, B, and all these different things, so you can read more. So please hit that QR code. Question, go ahead, Jack.
What are the advantages and disadvantages of using an agent to get Medicare and to get the supplemental plans?
The advantages and disadvantages of using an agent, an insurance agent, to purchase this. It's a mixed bag on that. Insurance agents are paid, and they're commission employees, and so they may steer you to a policy that they make more money selling, like a Medicare Advantage plan. Typically, when I talk with an agent, that's where they take me, because they make more doing that. And so they typically take it. Now, you can get a good agent. I talked to one the other night. I talked to somebody about, I just had some questions. I called up one of the agents for my company and asked them questions. And it was real interesting to talk with them, and they were helpful. So you could get some help, potentially. You also could get steered to the wrong product. So be careful with that. What we would encourage you to do is go out to and Google AARP, United Healthcare, and supplement, when it comes to supplement plans specifically. And a drug plan, you could do that as well with AARP, United Healthcare Drug Plan. Put that in. It's going to take you to a place where you can enter your zip code and your age and your gender. There are only a few things they want to know. And you can find out immediately what the cost of a plan, let's say, for example, a G plan would be in your area right now, what that's going to cost you at that age. And by the way, these will become more expensive as you get older. So it's another reason why if you're on a group plan, you might want to think about getting on Medicare. The earlier you get in, the lower your premiums are going to be. But let's just say that you can look immediately and find out, okay, this is what this plan's going to cost in my area. I like AARP as a barometer because they're the largest of all the supplement plans out there. And they're known to be a very good plan. So you can kind of take that, and then you can begin to compare if you want to look at Blue Cross or Aetna or Humana or any of the others. It'll just give you something as a guide, and you can decide what you want to do with that. But I think the advantage is that there's a little bit of an advantage because they're knowledgeable, but there's also a little bit of disadvantage because you might get steered to a product that's not the best for you. So it depends on the agent. Yes?
If the spouse with the credits is younger,
yes.
When do you sign up?
It's good. You talking about for Medicare or for Social Security?
Well, for Medicare.
Okay. If the spouse with the credits is younger, had this happen a couple of years ago where a guy called in, he was 65, his wife was 60, she was 60. He was 5 years older than she was. And he had opted out of Social Security, but she had been working as a teacher and doing a number of things. She had the 40 quarter credits. And so, and I don't know if I repeated this question, and maybe I should do that. When do you sign up if your spouse is younger and your younger spouse is the one that has earned into Social Security? Well, he had to literally sign up at 65, which is what I'm encouraging everybody to do, right? Even if you opted out, sign up at 65. Once she reaches the age of 62, Part A is free. But until she's 62, he's got to pay. And so that's how it worked. He paid for 2 years. She reached 62, and his Part A became free after that. Yes?
Going back to Social Security, I want to make sure I understand things right.
Okay.
So I delay mine, I have the larger
Yeah.
income. I delay mine till 70. My wife has less. There's no point in her waiting past 67 to take hers because there's no benefit after that point for her. Do I understand things correctly?
Yeah, now, because of your particular situation, so the question is there a benefit for a spouse with a smaller check to delay beyond 67?
Correct, that's the question.
Okay, and I would say it depends on that. And in my conversation with you, it depended on some other things that you were saying to me. But, you know, let's say the spouse has got a benefit of $500 a month on their own, but you, at full retirement age, had a $2,000 benefit. So that your spouse is going to be eligible once you do. If you're going out to 70, maybe you're going to go from $2,000 a month up to $3,000 a month. You're going to get a bigger benefit. But your spouse is eligible for 50% of your age 67 or your full retirement age benefit, right? So the spouse would be eligible for $1,000 a month. Their own benefits are $500 a month. If they delay to 70, they still won't get to $1,000 a month. So they shouldn't delay at that point. They should go ahead and sign up at 67, wait for you to file, and once you file, they'll jump up to $1,000. And so they'll get their benefits for 3 or 4 years, and then they'll jump up.
But if, say, she starts taking before she's 67, she'll have her half permanently reduced.
If she starts, that's right. If a spouse starts before full retirement age, they will not be eligible for a full 50% of their spouse's Social Security down the road. That's correct. So you want to wait to at least that point, even though you might be tempted to go in early. Yes?
Okay, that sort of answered half of my question.
Okay.
And that is, do I call Social Security? My husband opted out
Okay.
years ago, but he had his 40 quarters.
Yes.
And he's already signed up for Medicare. That's not a problem.
Okay.
He's not taken Social Security.
Okay.
He wants to in January. He wants half of mine, which is fine. Do we call Social Security and they set it up so he gets half of mine? Because half of mine is more than what he will ever get, no matter how long he waits.
Okay. And what are your ages? Who's older?
I am by 4 years.
Okay. You're 4 years older. Okay. And you're trying to delay your check out.
I'm past 70, so I've already...
You've already taken it. You've
Yeah.
taken your check.
Yeah.
He's already eligible for 50% of yours if he's full retirement age.
Yeah, he's 68.
Yeah, he's already eligible for that. What they do when you're eligible for a spousal benefit and you're eligible for your own benefits, you've got a number based on your own work record, and you've got a 50% of your spouse, you've got both, they're going to look at the higher one and give you that amount.
Do you call Social Security and they will take care of that?
He would need to go down, and you need to take like marriage certificates and things like that so that they know to connect the two of you.
You have to go to the office?
I would say to do it just because I think you can clear up any problems if you're in person. But no, you can call, you can do it online, you can do a lot of things, but there are a lot of ways to foul things up.
Yeah, our office is mobbed all the time.
Well, you know, but it's worth packing a picnic lunch and going down for the day, and just because, yeah,
It's a walk.
I know, but you mess up inside the office, and listen, y'all, the government clerks don't always understand the system. And I get people calling me all the time saying they don't understand what I'm doing. You ask for a supervisor. You're right there. You just ask for somebody will come over, and everyone I've talked to that had a supervisor came over, it was fixed immediately.
Great.
Okay, so that's how I would do it. I would go down,
I'll make you.
enjoy the picnic. Okay. All right. Okay, yes.
You said you had a G plan. Did you cover that? What was that all about?
Yeah, let me show you. I don't know how far I can go back here. Let me see if I can go back far enough to get this done. We were back talking about the supplement plans and before Advantage. So let's see, right here. This is what I wanted you to see. It says Plan G here. There's an A, a B, a G, a K, an L, and an N. So this is the G plan, which covers everything except The Part B annual deductible, $240. There's even some coverage if you're traveling, emergency care that you can get if you're overseas. If you do mission trips and things, you definitely want G. This is going to be helpful for you. You do not want an Advantage plan if you're going out of the country. You don't want an Advantage plan if you're going to travel at all because you've got a network you have to stay in. So, yeah, but that's a G plan. That's what a G plan is.
Thank you.
Sure.
But it's so confusing because you got the A, B, and the AB and the G. It's almost like they're trying to make it confusing.
I think of it as job security myself, but but you're right, it's very confusing. But it's government, right? So everything is going to be confusing. If you get the brightest people in the country together to create these programs, this is what you have. Confusing programs. Okay. All right. Other questions and thoughts? All right. Yes.
So I had a friend advise me to take my full Social Security at my age, which would be 66 and a half. And he told me if you invest that money, you're going to wind up making more money than if you wait until you're 70, even with the COLA. And I'm like, I don't have it. What do you say to that?
Just say no. Yeah, if somebody advises you to go ahead and try to take the money, first of all, realize it's taxable, right? So you can't reinvest all of it. You can only reinvest what you have after taxes. Second of all, you have to take on some risk in order to beat Social Security. They're giving you an 8% return each year you delay. 8%, and they're giving it to you a little bit every month. So if you only delayed 3 months, you get 3 months worth. They're giving you an 8% return. To get a better than 8% return in the markets, you've got a lot more risk than this. So I would say don't do it. And let them invest it at 8, risk-free for you, and just let it stay there in their hands and grow. Because that's what it'll do. If you,
that 8% doesn't include the cost of living increase that normally comes, is that correct?
There's a cost of living increase every year based on what your amount is. So if you delay and you get those 8% increases, it'll be on that too, all the way through retirement. It's very hard to beat this. It's very hard to beat it. We used to refer to this as the best deal in town, delaying the larger check till 70. And that's still the basic strategy here, is delay that larger check. If you're a couple, you got 2 checks, delay that larger check to 70. And it's easy. You just do nothing.
If I could add something to help you, like Dave Ramsey does that, okay? Yeah. But he's using the 100-year average of the S&P 500. But that's a 100-year average.
You don't have 100 years to play with.
You may be in the bad, you may be on a 10-year bad run. You know,
Yeah.
I agree, the 100-year average is 10%.
Let me say this too, and I'll try to say this well. I love some of the things that Dave Ramsey does. I used to work for Ron Blue and Company. I don't know if you've heard of Ron Blue, but that's where I got my CFP there, working as a financial planner with his group. And what Dave did is he took the same concepts of Larry Burkett and Ron Blue and sort of popularized them and began to travel and do freedom tours and different types of things. What Dave learned was that budgeting, getting out of debt, very, very helpful. And he's helped a lot of people at that level. Before that, David was a real estate agent, and he doesn't have a background in finance. And so when he gets into investments, he makes a lot of mistakes. And there have been a lot of people that have tried to help him see those mistakes, and he's just the type of guy that doesn't hear anybody that disagrees with him at all. So be very careful. If you're following Dave, follow him on that budgeting stuff, on the getting out of debt stuff. He's golden on that stuff. But don't follow him in his investment strategies. It will not land you in the right place. So, go ahead.
I qualify for Social Security, but it's going to be a lot less than what my husband, 50%. Can I start collecting mine when I get to the age, and then, or will it be mine, or can I always get the 50%?
Well, let's start with what's his age and your age. How much is he older?
We're the same. We just
You're the same age.
60 this year.
Okay. All right.
I'm a little older, 8 to 10 weeks.
All right. And well, and so Okay, so you both have a check, though. You have one based off your own work record, and he's got a check based on his work record. And you're saying that 50% of his check is more than your current check, right?
I stayed home and took care of it.
Absolutely, I fully understand that. It's true with us too. And let me ask this question. If you delayed yours to 70, is it more or less than what he would have of half of his at 66
To check.
or 67?
Yeah, I'll check.
Yeah, we need to know that, but I think in general, it would probably be okay if he's got the larger check for you to go ahead, claim at full retirement age, and then get a bump up once he's filed. And that's when you get the 50%, is once that spouse is filed, then you get the bump up down the road. All right, guys, the doors are opening. That's the signal that we need to quit. We are available to talk with you. We would love to talk with you. Let us know how we can serve and help you guys, okay? All right, thank you very much.